Hello everyone, myself Dr. Tapush Kumar Par and welcome to our channel Physiomax Organization. And as we are continuing our anatomical educational series, today we will be talking about one of the most important sesamoid bone of our body, and that's about the patella. This is what the patella is, and this is the largest sesamoid bone of your body. The reason why this is called as a sesamoid, because this of the sesamoid bones which looks like a seed, and also these sesamoid bones does not have a direct function. They are dependent on the muscular contraction. That's the reason why this bone is called as a sesamoid bone. We'll be talking about this patella. This patella which is present in the intercondylar notch, which is in between both the femoral condyles. And this patella alone cannot do any such movements. It's dependent on the quadriceps superiorly, patellar tendon inferiorly, laterally by the IT band and medially by the VMO. That's what it's the function of a sesamoid bone is. Now we'll be understanding about the anatomical position of the patella. In this anatomical position of the patella, superiorly, that is the base, and this is was the lower angle or the apex. This is the anterior surface which is bit flat, and if I turn off the posterior aspect of the patella, both the sides it's concave in nature, and in between there is a convexity. The reason why there is a convexity in between, the reason is this convexity can move in the concave intercondylar surface of the femoral condyle very smoothly. And if I talk about the two surface, this is the anterior surface and this is the posterior surface. And also, as this patella bit somewhat looks like a triangular in structure, this patella is having a three border. This is the medial border, this is the lateral border, and this is the superior border. So once more to see, this is the superior border of the patella. This is the medial border of the patella, and this is the lateral border of the patella. So there are three borders of the patella and two surfaces of the patella. Coming to the ossification, the patella, with like other bones, it starts ossification from the 7 weeks of the intrauterine life, and it's end up with the age of 9 to 11 years. That's what the ossification of this patella is. Coming to the bony parts, although this patella does not have any such of bony landmarks, we can see the superior region of the patella. It's having a flat for the insertion of the quadriceps tendon, as this patella a bit of triangular in nature. In the lower portion we can see it's bit of conical for the attachment of the patellar tendon, which get attached with the tibial tuberosity. That's all the two most important part. And if we see on the posterior aspect, there are two concavity side of the patella and there is one convexity side of the patella. This is one of the convexity side of the patella, and both the side there are two concavity side of the patella. Coming to this, if you see, this is the concavity side, which is larger, and if I just keep the patella will move towards the larger concavity side, and that's what we will understand the side of the patella. Mostly some of the times the patella is to move towards the larger concavity side if it shifts towards this side. If it is the right, then this is the right side of the patella. Coming to the muscle attachment, this patella, it's having a muscle attachment superiorly, inferiorly, laterally, and then medially. Superiorly, the muscle which is getting attached is the quadriceps tendon, which is attached superiorly. Mainly the muscles of the vastus, lateralis, vastus intermedialis, vastus medialis, and rectus femoris, which is getting attached on the superior portion of the patella. In the inferior portion of the patella, from the inferior portion of the patellar tendon which comes out and get inserts on the tibial tuberosity. On the lateral aspect, there is a attachment of VM, there is attachment of IT band, iliotibial band, which laterally, few fibers of the IT band which holds the patella laterally. And if you consider this is the medial aspect of the patella, this side there is a attachment of the VMO. So if I show again the patellar muscular attachment, if I consider this is the lateral side of the patella, this is the medial side of the patella, this is the superior aspect of the patella, this is the inferior aspect of the patella. This is how the quadriceps tendon is coming mostly from in between the vastus intermedialis and above the rectus femoris. From the lateral aspect we are having the vastus lateralis, from the medial aspect we are having the vastus medialis, the muscles. Here the continuation of the vastus medialis, there is the vastus medialis obliquus. From the inferior portion of the patella, the tendon which comes out from the inferior portion is the patellar tendon, it gets inserts in the tibial tuberosity. And this is the lateral aspect where there is a attachment of the few fibers of the IT band. These are the muscle attachment of the patella. Now we will be talking about the applied anatomy of the patella. Applied anatomy of the patella might shift superiorly, the patella might shift inferiorly. When the patella shifts superiorly, it is called as a patellar alta. When the patella shifts downward, it is called as a patellar baja. Some of the times the patella might shift superior-laterally, that is the time it is called as a gross superi patella. But if there is a weakness of the VMO, the patella shifts laterally, that is called as a lateral patellar maltracking. So, with the applied anatomy, there are 4 total applied anatomy. If the patella shifts superiorly, once more to revise, this is called as a patellar alta. If the patella shifts downwards, that is called as a patellar baja. If the patella shifts superior laterally, it is called as a gross superi patella. And if there is a weakness of the VMO, the patella will shift laterally, that is called as a lateral patellar maltracking. So with this, we will end up the applied anatomy, the clinical anatomy of the patella. I hope you people understood the anatomy portion of the patella. So those who are new for this channel, don't forget to subscribe the channel, and those who are watching this video, don't forget to like this video. Stay tuned with us to learn detailed portion of anatomy. Thanks once again.